Take Home Pediatrics, a continuation of episode 5 on sleep. This is the second of the series where we're going to talk about good sleep hygiene. I'm Dr. Bhumi, and please remember this is just an informational video and we are not a medical practice, so if you have any concerns about your child, please call your pediatrician. So what is good sleep hygiene? Is just basically setting good sleep habits. Now, the first 3 months of life, which is actually known as the fourth trimester, there are no rules or regulations about sleep or naps. Okay, you will hear there are some kids who are fabulous sleepers from the beginning, but some of them are not. And so yes, you can try to set a small routine, but please don't stress yourself out about it. Actually, the most important thing at this age is to create a safe sleep environment. So please go to aap.org and their section on safe sleep recommendations. But here are some brief points. Number one, place your child in a bassinet or a crib to sleep, not on the couch, not in your bed. And if you are bringing them to your bed, just make it for feeding or soothing purposes. We do want your child in your room for the first 6 months of life, but in their own crib or bassinet. Second, make sure that you have a firm mattress, fitted crib sheets, no bumpers, and that also includes those braided bumpers that are so popular on social media right now. Please do not use them. Make sure you're lying them on their back and on a flat surface. You can swaddle them, but we want you to stop the swaddling around 2 months of age, because that's when they are trying to roll, and that can actually become a hazard. Make sure that there are no soft items in the crib that can be a suffocation hazard, such as stuffed animals, pillows, and blankets. And then avoid those commercial sleep devices like the wedges or the bedside sleepers, and please monitor for any kind of recalls for those items. And lastly, make sure you're dressing your child appropriately for the temperature in your house. They should basically not have any more than one extra layer compared to you. So when you've created this safe environment, really the other things you need to focus on is that your child is not staying awake too long at this age. As you know, our newborns and infants pretty much sleep, eat, and wake, and then sleep, eat, and wake. So what do you do to start creating just a day and night schedule? Go ahead and start giving them daytime cues and nighttime cues. So the daytime cues are, hey, listen, during the day, I'm going to feed you on a schedule as much as possible. I'm going to socialize with you. I'm going to play with you. The lights are going to be on. And then in their nighttime cues is, listen, I'm going to go ahead and feed you when you wake up, but when you do feed, it's going to be dim. We're going to be very quiet. I'm not going to socialize with you, and then I'm going to put you right back down to sleep. And so this is going to create a nice routine until we get to that time where we can actually set some really good ones. So now that your child is 4 months old, they're sleeping little longer stretches. So what we like you to do is go ahead and get a routine started where, hey, they're going to have a morning nap, they're going to have a early afternoon nap, and possibly a short late afternoon nap. So we're creating that schedule. In the meantime, also, I want you to set a bedtime so that you're doing a routine at the same time every day. And our focus at this age is to start getting habits where our child is going to learn to self-soothe, which means they're not relying on feeding to fall asleep or rocking to fall asleep. Because if they cannot do that, they are going to have a lot of nighttime awakenings. We all wake up at night, but we know how to put ourselves to sleep. And so we need our babies to learn to do that also. So in addition, you want to start monitoring their naps because as they get older, the nap requirement changes. And so, as we mentioned, there are about 3 naps at 4 months old, but that as they're approaching 6 to 8 months old, they are going to drop that late afternoon nap. And then once we get to 12 to 15 or 18 months of age, actually, they can actually be dropping that morning nap. And then by the time they're 3 to 5 years old, they completely get rid of naps in total. So we want to make sure that they're not overnapping where it will affect their nighttime sleep. So once we are ready to have a nice routine, we like you to make sure that you're transitioning your child so that they know that they're going into a nighttime routine, and that's really just starting to calm things down. Make sure that your bedtime, like you said, is consistent, whether it's a weekday or a weekend. Because if we have those late nights on the weekend, it is going to confuse that child into going back to that routine on the weekdays. Create a nice sleep environment where the room is cool, quiet, and dark. And then make sure you're using the bed for only sleep purposes. Don't have your computer on the bed, or don't play games on the bed, because we want your child's brain to associate the bed with sleep. Also, once that's there, we want to make sure now we're using a routine where we have a series of events that's going to indicate to the child that, hey, it's almost time to go to sleep. So most common things are a bath, and a warm bath is very important because it actually calms the body down. And then maybe some reading, and then we brush our teeth, and then we sing a song, then we kiss them goodnight, and we leave the room. Just set limits, because our toddlers can be very persuasive and ask you for one more book or one more hug. So remember, we kiss them goodnight and we leave the room. We do not linger around. And then also try to be one step ahead of them. Offer that last sip of water, or offer them the last trip to the bathroom before you leave, so that they cannot manipulate you. Now, if they're not falling asleep right away, it is okay. They can stay in the room quietly, as long as you know your room is safe, that they can't climb on things or bring things down to hurt themselves. But you can let them try to fall asleep on their own. Now, I know a lot of you want your child to kind of wind down and watch a 30-minute TV show, but unfortunately, the blue light from the screens actually suppress the secretion of melatonin, so it actually creates sleep problems. So we want you to eliminate any type of screen 60 minutes before bedtime. So instead, we want those calming routines. We talked about a few things, but for our older kids, you can add meditation, you can add breathing techniques, you can even add some fine motor activities, such as Legos or coloring. Those fine motor activities have been associated with decreasing brain stress. You can always use white noise for any age. Now, to make your routine go a little smoother for your toddlers, while you're going through the routine, you can offer them choices, but please limit them to two, which means, hey, you want this pajama or this pajama? Or, hey, do you want this book or that book? Another thing that helps our toddlers is to get them a security item, which means like a small little stuffed animal or a little blankie, or even a parent's shirt. And this is going to help them when you're not around. And what we usually ask you to do is present this to them during the day while you're cuddling with them or reading them a book, so they start getting associated with that item. In addition, for our school-age kids, there are a few extra things that I want you to know. Don't have a clock near their bed, because if we are having a hard time falling asleep, we're going to keep looking at that clock, and it just makes that into a vicious cycle. And if we can't fall asleep, then we should get out of bed and sit in a quiet place and do a calming routine, like, again, reading or a breathing technique, and then go back to bed to try to fall asleep again. Avoid caffeine in the afternoon or later. I know many people say that caffeine does not affect them and they can still go to sleep, which may be true, but it will still affect the quality of your sleep cycle. Also, make sure they get 60 minutes of physical activity in during the day. And then for our anxious kids, those ones who just lay in bed and they're just thinking and thinking and worrying and unable to fall asleep, have a set aside time for them in the daytime, where you can call it your talk time or your worry time, where you let them know that we're going to sit down for a few minutes and you can talk to them, discuss your feelings, discuss what you're thinking about. You can even have them write in a journal or even draw. But this is to let all their worries out and not bring it to bedtime. So um, basically, having a good nighttime routine will induce a good sleep cycle. And then remember, we want to make sure that they sleep in their beds and nowhere else, not the couch or not in your bed. Even after we have all of these good habits, remember there are some children who will still fight sleep. There are some children who will still have night wakenings. And so in our next series, we're going to talk about how we can tackle those problems. Thank you for listening, and we'll talk to you soon.